Hey, Dr. Rohde, welcome back to Contagion.
Hey, Grant, thanks. It's always a pleasure to join you on the show.
So, we are now a few weeks into the semester, and things are looking good. Now, nobody at universities around the United States is going to want to declare victory before the end of a first semester, as we're just starting up the fall.
Correct.
But let us know, as of mid-end September, how are things going?
Sure. At Texas State University, as you remember, last spring, we kind of went fully remote, and then we transitioned through our summer semester, also remaining pretty much fully remote. And then for our university, on August 24th, we actually came back this fall face to face. But I will kind of preface that with uh, actually many of the programs, especially the freshman and sophomore level, that had really large classes, classes with 400 people, those are actually still online. So even though we're kind of saying face to face here, we have a certain percentage that are face to face, including my own program. So clinical laboratory science and many of the programs in the health professions college. There's 8 of our programs here with things like nursing and physical therapy and so forth. As you can imagine, we have external accrediting guidelines that basically we have required standards for competencies and clinical skill sets. So we have to be back face to face. You just can't, you can't swim without getting in the water, is what one of my colleagues always says. And so Texas State mandates mask, and we have limited capacity in rooms. So for our program and many like ours, we're very fortunate with it. We have smaller cohorts. We have 20 students per junior and senior class, and we do lectures in a room that holds almost 80 people. So we're 10 foot apart, and we're still wearing masks. And then our labs are half of that, so 10 people, and we're spread out in there too. And just doing it. My students are doing a great job following all the mandates and rules. And as I keep telling them each week, this is the end of week 5 that we're in. Every week's a success that we get to come back together. So, keep following the rules, keep following the guidelines, and hopefully we'll move into the spring. I think we'll probably kind of stay this way unless something drastically changes. But I'm hoping that, next academic year, fall of 21, maybe we look at something different. But as you know, it's hard to predict right now. I just sat through a noon town hall with Dr. Fauci. One of my primary professional organizations is the American Society for Clinical Pathologists, and we had him today for a town hall, just about 30 minutes because he's bouncing around with congressional hearings. But I just have to drop this in because the man is so motivational and inspiring. He was talking about how he deals with burnout in his family. He's quite a big family man with children, a wife, and others. And it was interesting. I mean, we all know how difficult this pandemic's been. You and I were just talking about it with regards to family and things like that. But he really struck a nerve with me because he basically responded to the question of burnout's not an option for me. People like me, like Dr. Fauci, he's like, I can't really burn out. There's too much to do. He's got encouraging and cautiously optimistic outlooks for a coronavirus vaccine, and also with, of course, following all the typical guidelines that he and CDC has placed out there. So it really gave me some hope today to hear him talk. So that was kind of a pleasure hearing him today.
That's good. That's good. Absolutely. And no, I mean, he's certainly a person of character. So
Absolutely.
it's strange when you see there's a scientific debate going on, but sometimes people get very in the weeds with attacking people and just doesn't really contribute much.
It really doesn't. I mean, regardless of, and again, I think me and you think alike here. I mean, regardless, you have to give public health servants, and that's what they are. They've been working their whole life. I've been in that realm, and Dr. Fauci and other people like that, people you'll never know, who really go to work every day for the betterment of the public. And we're all, we all have our faults, and we don't have our best hat on every day. But in general, they're out there doing their best for the public's health. And so it's really not a political issue for us, at least with respect to getting things in order for health. And so it is frustrating sometimes to see that happen, but I hope at the end of the day, the country will embrace public health and where we're at, and we'll continue to move forward as we face the next issue, because there will be a next issue.
Oh, I mean, there's always another coronavirus debate around the corner, or another
Absolutely.
pandemic. I mean, this isn't going to be the last pandemic, and I think it's important for everybody who's on team reduce morbidity and mortality to understand that we're all coming from the same place,
Absolutely. I mean,
of
we're all in it
preventing
together. It's a global
health.
community. We have to fight this together. Absolutely.
So to put a pin in our COVID conversation just for now,
Sure.
uh, I know some of your other research areas of interest. Can you tell a little bit about rabies? World Rabies Day is coming up fairly soon.
Yeah. Thank you. Thank you for giving me the opportunity to talk about something other than COVID, right? It seems like
A
that's all we
rare
talk about
opportunity.
now.
Yeah.
But we have to remember, as you know, we've talked about, disease does not take a vacation just because there's a pandemic. So rabies is an area that I've worked in since the beginning of my career. Back in '92, when I finished my master's program in virology, I left and went to work for the Department of Health in Austin, Texas, and worked actually right off the bat. I worked in newborn screens, which is wonderful. But then I eventually transitioned into virus isolation and ultimately into rabies and arboviral disease, and worked with the zoonosis control division. So spent about 8 or 9 years in that realm, and that's really what kind of I cut my teeth on with respect to public health and medical laboratory testing. And so to kind of jump past all that and move into the world of rabies days, that's where I kind of grew my research interest and diagnostic world in that world. But through my years and through my even my academic appointments, I've always kept rabies in my kind of lane of one of my primary research interests. As you may or may not know, rabies is kind of thought of as a neglected disease. We don't talk a lot about it in the United States because, frankly, we don't see as many human deaths as other countries. But rabies still kills approximately 59 to 60,000 people a year around the world. It's 100% preventable with vaccination. And so in 2007, a group of countries, and the United States is one of them, set up a World Rabies Day. It falls every September 28th, so it's coming this coming next week on Monday. And this year, the kind of the vision is collaborate, vaccinate. And so one of the primary goals of this group is to eliminate canine rabies, dog rabies, by 2030 around the world. And that is doable, because if you vaccinate animals, as you know, even humans, if you vaccinate enough of them, you can remove that particular virus agent from having a reservoir. In fact, in Texas back in '94, when we began the oral rabies vaccine program that I had the honor and privilege to serve on as an inaugural member, we had the CDC and the Canadian Ministry of Natural Resources involved, the Texas National Guard, and just numerous agencies. We went into Texas and we aerially distributed something called oral rabies vaccine. And the principle is that wildlife, which is a reservoir for rabies, would eat these baits. They look like dog food, and inside of them they had a liquid vaccine. And so you'd aerially distribute them, and then the coyote and fox and bobcats and what have you would come along and eat them, and it would spread down their tonsillar region and basically immunize them. And so we've eliminated canine rabies in Texas. We haven't had a case here since the early 2000s. So pretty proud member of that initiative, and have continued now to work with respect to writing and speaking and trying to educate the public around this really important disease that continues to kill tens of thousands in other places that don't have the resources that the United States does.
Well, and I appreciate you highlighting that because, and we just discussed, oh, we're going to talk about something other than coronavirus. Impossible. That is something that is an emerging virus from an animal reservoir.
Sir.
So, does rabies have lessons for us about controlling, in general, zoonotic diseases?
Yeah, I think I mean, it certainly can be used as a model, much like, I mean, you could look at other viruses as well or other agents, but in my experience, I certainly think rabies could be used, and the team we've developed across the world with respect to trying to get, this end rabies by 30 is kind of the initiative right now for canine rabies. It's going to be difficult to eliminate it completely because rabies is also found in bats, which are aerial based, so that makes it more difficult. But there are people, believe it or not, looking at kind of ingenious ways to put recombinant vaccine into insects that could be kind of released and fed into bat colonies, which would be
Wow.
amazing and crazy. So just interesting stuff. But yeah, I mean, I think Dr. Fauci said it today when I was listening to him, and we all say this. This is not a secret. Um, Pandemics and epidemics have to be addressed collaboratively. There's absolutely no way we can do this as an isolation in a country or a state or even in a region when you have animal reservoirs, including birds and things like that, that can transmit influenza virus around the globe and so forth. So we have to find ways to look at animal health as well as human health, and in some instances, even environmental health. And, the initiative of, the hashtag of One Health, that's kind of where that came from, is that you must look at all facets and levels of animal, plant, environmental life to kind of create that opportunity to make um, a more healthy planet for all of us.
Well, and that goes down to, I mean, in January, myself included, I mean, I had a little bit of knowledge about game markets because of Ebola journalism I'd done. But a lot of us still didn't know very much about the agricultural practices that are involved in the animal trade and things of that
Right.
nature. But it's also something that's not just in a game market. It's something that's in the way we raise agriculture in the West too. I mean, there's
Absolutely.
antibiotic resistance that can be cultivated by the way we do agriculture here.
Absolutely. And it's interesting. That's a perfect little bit of a segue for me because as we've talked about before, my kind of secondary, and they're not really first and second; they're kind of equal. But I love to work in the area of antimicrobial resistance. In fact, I continually beat the drum, as a lot of my colleagues do, that antimicrobial resistance, sometimes referred to as AMR, is kind of a slow burning pandemic. I mean, it's been here for decades, and it's getting worse and worse and worse. Um, World Health Organization, through predicting and modeling, estimates that by 2050, we'll have 10 million dead and up to $100 trillion economic impact due to AMR. And it will replace cancer as the number one infectious disease to kill something. So, one person every 3 seconds will have an AMR infection if we kind of continue on this trajectory. So, um, when you think of animal health practices and how we utilize antibiotics in animal feed, how we let that in the groundwater, into the environmental systems, and the ongoing issues of treating, you know, empirically sometimes maybe too much with respect to not running a confirmatory medical laboratory test. And for your audience, I'm a medical laboratory professional, and this is something I actually talk to the audience and the public about all the time, is if you don't learn anything else about going to the lab or going to the hospital, if you have an infection or you think you do, ask. Sometimes demand that you want to know what the agent of infection is, what's causing your infection, and then have they run a susceptibility test to find out the best antibiotic to treat it with. Because no one, no physician, no medical laboratory professional, no scientist truly can say with 100% certainty that your scratchy throat is strep throat Streptococcus pyogenes without running a test. Yes, they can make educated, strong guesses and treat empirically, but ultimately, if you do that all the time, that's a problem because you might be treating an allergy, you might be treating viral pharyngitis, and so forth. So, and I know in emergencies like sepsis, or someone's in danger of dying, you have to treat empirically. I'm not silly. You have to do it sometimes, but you certainly can follow that up with testing and make sure you have the right antibiotic for the right bug, so that you don't drive resistance. On top of people taking them when they're out of date or borrowing antibiotics and kind of self-diagnosing.
Yeah,
And if everybody's honest, we've probably all kind of been there where you beg the doctor for a pill,
of course.
because when we hurt, right? I mean, we want something to make it better, but we have to all kind of think about, as we approach World MRSA Day, which is October 2nd, which is an area I spend a lot of time in with Methicillin Resistant Staphylococcus aureus, that we need to find, a happy medium that's both going to curb AMR, but also allow physicians to do their job in the best ability that they can.
Well, and that speaks to some real tensions that don't have an easy answer, because you can't just say don't use antibiotics without a test ever, like you pointed
Right.
out. I mean, to that point, early on in the COVID pandemic, there was a ton of just in case antibiotic prescribing
Sure.
because there was a fear that there were more bacterial. It's not impossible, obviously, but there was a fear that there were more bacterial co-infections than we ended up seeing community
Right.
wise.
Right.
Um, and so there's sometimes you care about your patients and
Yes.
you're like, I'm going to throw the kitchen sink at them.
Yes. Yeah. I
And
mean, for
that
sure. That
is a really human
that's
quality.
yeah, and that's where the rubber hits the road, right? I mean, I'm not going to sit here and second guess every physician because they're amazing. Physicians do wonderful jobs every day, but I do think we need to have those conversations about that very situation. You saw that piece I talked about in Forbes this past week with regard to COVID and antimicrobial resistance. So, infectious disease pharmacists, clin pharm ID people need to be brought in. We need to continue to have antibiotic stewardship programs brought into hospitals and kind of think about how we're going to triage and approach viral season. With respect to maybe we try to make sure we're not throwing antibiotics when we don't need it. But even looking at COVID-19, one of the kind of headaches when we went kind of down that road of hydrochloroquine use, they were doing that a lot with an antibiotic, like as a combination. And who knows what damage was done with countless prescriptions, handed out in that way. And I certainly understand sometimes you have to do things to cover the bases using a broad spectrum antibiotic or something like that. I just think we need to get better
Well,
at how
and
we
you have to
triage.
wonder if we saw the kind of prescribing that we saw in hospital. An earlier guest, Dr. Goff, brought up to me,
Oh yeah,
well, what was happening outpatient during that time then?
right.
And
Yeah,
that
Dr.
we don't
Goff
know.
is great. Yeah, she's an ID pharmacist, right? I've met
That's
her
right.
through Twitter actually, and some of her colleagues. A medical laboratory professional, and physicians and even nursing. I talk about this more and more. Your best friends are pharmacists, especially ID pharmacists. So again, Dr. Goff is amazing, and I've worked with some of her colleagues on articles and things like that. So the more we can get these professions doing this, instead of this, the better off the patient. Because ultimately, when you can get antibiotic stewardship programs being bought in by everybody, then there's some professional accountability and peer pressure and things like that. It's really effective. So I'm excited about the future because I think with the DCLS and how the medical lab profession is moving more and more into the patient and public um, field of view due to the pandemic, we're going to have a bigger place at the table kind of to discuss these issues.
And I mean, well, first of all, maybe we should get you guys on a panel to talk about AMR.
Yeah, that'd be great, wouldn't it?
But actually, that brings me to an interesting thing about the public knowledge when it comes to AMR, because something else we had talked about a while back had been me and Dr. Goff, the first time we did an interview, was that oftentimes we say antimicrobial stewardship, and people don't know what that means.
Right.
So antibiotic stewardship conjures up what it is in the mind a little bit more, but then at the same time, it's not just antibiotics that need stewardship. Isn't
Right.
that right?
That's absolutely right. So, I mean, yeah, you're right. I mean, sometimes we can't help but get in our way of our own jargon in the healthcare area, and I'm guilty of that as well. It's a good point. I mean, when I speak to the public or write articles for the public or do interviews like this, I'm always trying to think about better science communication. Another thing I'm passionate about. We have to raise the health literacy of the general population and how they kind of think about things, even how they digest information. Is it correct or inaccurate? So, yeah, I mean, anything with respect to jargon or ways we can work together to make more sense to the common person around what stewardship really means. Maybe we can find better words or better ways to get that point across, because ultimately being a good steward, for instance, of your money is making sure you use it correctly. So maybe we need to find ways to get that language a little different for most people. Good point though.
It's not something I have the answer to. I am saying antimicrobial stewardship when I talk about this, but
Yeah.
it's something I wanted to float because it's
Yeah, I mean, it's actually a great comment because it's something I'm pretty passionate about. And when I think about it, it makes me want to start thinking about vocabulary a little bit when I start writing more, because AMR or using that big word all at one time probably doesn't make a lot of sense, because what the word's trying to get across is any antimicrobial. So whether you're taking uh, penicillin, or whether you're taking metronidazole for a fungal or parasitic infection, or you're taking some type of acyclovir for a herpes viridae infection, a viral infection,
I
or
mean,
one
I've
of
even
the
heard about something described as antiretroviral stewardship.
right,
In terms of
right,
HIV.
HIV, right? That's antiretroviral is kind of directed at HIV because it's a retrovirus. I mean, we kind of need to think about our language, I think, sometimes, at least when we're talking to the public,
Mhm.
and maybe trying to educate, because we're always going to use that
Well,
language, I
it's a
think.
meeting in the middle too, because you also don't want to condescend, because I'm sure lots of people too benefit from
Absolutely.
somebody going
Absolutely.
out there and saying antimicrobial stewardship is this. And
Right.
so I'm sure it's a delicate balance that
It is. It's
you know,
absolutely a fine line, because you're absolutely right. You don't ever come across as you can't reach this level of
of
understanding,
course,
because
yeah.
most
So
most people can. In my
open
experience,
question.
yeah,
Yeah.
most people can get there, but you might approach it, carefully in how you do that.
Well, so we've now covered coronavirus, rabies, antimicrobial stewardship, World MRSA Day, October 2nd. What
Right
else is
on.
on your mind as we wrap up?
First of all, thank you again, Grant, for bringing me on. I really appreciate the opportunity to continue to try to educate in these areas, and to discuss not just the current pandemic, but the overall issues that are facing, I think, public health. I think one of the things I'd like to kind of wrap up with, after hearing Dr. Fauci today, and I'm a passionate public health person as well as a medical laboratorian, is trying to, you know, get people viewing your show, as well as others that are out there that I speak to really think about public health professionals and those that are going to work every day right now during this pandemic. I recently read an article where I think it was over 1,100 healthcare workers have fallen victim to COVID-19. So, and of course in the U.S. now we're over 200,000 deaths. Um, we have about 4% of the population, but we're responsible for about 20% of the deaths globally. We've got to do a better job, and we've got to really start talking across uh, individuals in silos of how we can do a better job to approach a national strategy. We have to learn some lessons, not just for this instance in our lives, but moving forward. I mean, as you just said earlier, and I always talk about, there is a next agent. There is another epidemic coming, and potentially a pandemic when you think about animal reservoirs and you think about world travel, and how many people will eventually start traveling again. It's easy to get around the world in less than a day now. So it's not going away. And the only way we can kind of approach it is globally and together. And hopefully we can all kind of wrap our brains around that and be supportive of these efforts, without being so um, concerned about ulterior motives, behind any of this, whether it's political or otherwise, because it's health, it's public health, it's global public health. It is not just you. It is your world around you, including your own family and friends and those in other states. So that's kind of what I think I would like to end with today, as we're in the middle of public health, kind of appreciation month anyway, so that's a great time to be thinking about this.
Dr. Rohde, always a pleasure. Thanks for coming.
Thank you, sir. See you next time.